Urinary tract infections, or UTIs, are incredibly common, especially among women. They occur when bacteria, typically from the rectal area, enter the urethra and infect the urinary tract. This tract includes the urethra, bladder, and even the kidneys in more serious cases. While UTIs can be painful and bothersome, the good news is that they are usually easily treatable. It's important to understand that anyone can get a UTI, but women are far more susceptible. This is largely due to anatomy. Women have a shorter urethra than men, making it easier for bacteria to travel to the bladder. UTIs are not contagious, meaning you can't catch them from someone else. However, certain activities, like sexual intercourse, can increase your risk. By understanding the causes and symptoms of UTIs, you can take proactive steps to protect your urinary health. The vast majority of UTIs are caused by bacteria, most commonly Escherichia coli or E. coli, which is typically found in the intestines. These bacteria can enter the urethra, the tube that carries urine from the bladder to the outside of the body, and travel upward, causing an infection. Several factors can increase the risk of developing a UTI. These include sexual activity, as intercourse can introduce bacteria into the urethra. Poor hygiene, like wiping from back to front after using the toilet, can transfer bacteria from the anal area to the urethra. Certain medical conditions, such as diabetes, pregnancy, and a weakened immune system, can make individuals more susceptible to UTIs. Additionally, some people are more prone to UTIs due to anatomical factors. For instance, any obstruction in the urinary tract, such as a kidney stone, can trap bacteria and increase infection risk. Similarly, using a catheter, a thin tube inserted into the bladder to drain urine, can also heighten vulnerability to UTIs. UTIs don't always cause noticeable symptoms, especially in the early stages. However, when symptoms do occur, they can be quite bothersome. Recognizing the signs early is key to seeking timely treatment and preventing complications. Common symptoms of a UTI include frequent urination, feeling the urge to urinate more often than usual, even if only a small amount of urine is passed. A burning sensation during urination is a telltale sign of a UTI, often described as a sharp, painful sensation when urinating. Cloudy or foul-smelling urine may appear, with the urine being cloudy, discolored, or having a strong, unpleasant odor. In more serious cases, where the infection has spread to the kidneys, known as pyelonephritis, you may experience fever and chills, with a high fever often accompanied by chills, indicating a kidney infection. Back or side pain, just below the ribs, is a common symptom of kidney involvement. Nausea and vomiting may also accompany kidney infections. Section 4. Diagnosing and treating UTIs. Diagnosing a UTI typically involves a simple urine test. Your doctor will analyze your urine for the presence of white blood cells, red blood cells, and bacteria. A urine culture may also be performed to identify the specific type of bacteria causing the infection. This helps determine the most effective antibiotic treatment. Treatment for UTIs usually involves a course of antibiotics. It's crucial to complete the entire course of antibiotics as prescribed, even if your symptoms improve before finishing the medication. This helps ensure that the infection is fully eradicated and reduces the risk of recurrence. While antibiotics are the mainstay of UTI treatment, several home remedies can help alleviate symptoms. These include drinking plenty of fluids, which helps flush out the bacteria from your urinary tract. Cranberry juice or supplements can help prevent bacteria from adhering to the urinary tract lining. Over-the-counter pain relievers, like ibuprofen or acetaminophen, can help manage pain and discomfort. Section 5. Preventing future infections. Preventing UTIs involves adopting healthy habits that reduce the risk of bacteria entering the urinary tract. Simple lifestyle changes can make a significant difference. Practice good hygiene by always wiping from front to back after using the toilet to prevent the spread of bacteria from the anal area to the urethra. Stay hydrated by drinking plenty of water throughout the day, which helps flush out bacteria from the urinary tract. Urinate after intercourse to help clear any bacteria that may have entered the urethra during sexual activity. If you're prone to recurrent UTIs, your doctor may recommend additional preventive measures, such as taking a low dose of antibiotics daily or after sexual intercourse to help prevent infections. For postmenopausal women, vaginal estrogen therapy can help restore the health of the vaginal tissues and reduce UTI risk. Remember, if you experience frequent UTIs, which means more than 3 or 4 per year, it's essential to consult your doctor to rule out any underlying medical conditions that may be contributing to your infections.